Hey everyone, welcome to this targeted explainer. I know you're all gearing up for your upcoming quiz on NSG 331. So today, we're just going to dive straight into chapters 20 through 23. You can kind of think of this as your focused faculty review. We're going to break down the physiologic changes in the older adult, pulling out the exact definitions, the clinical cues, and those absolutely crucial nursing interventions you need to master. So let's get your cognitive load organized and get you totally prepped for success. To keep things really efficient today, we're going to hit 4 main sections: metabolic disorders, musculoskeletal and joint health, cardio and respiratory changes, and then we'll tie it all together by wrapping up with a clinical case study featuring a patient named Nancy.
All right, diving right into Section 1, metabolic disorders, focusing on diabetes and thyroid priorities.
So, out in the clinical setting, endocrine changes in older adults really dictate a lot of your immediate daily nursing actions. Understanding these priorities is absolutely essential, not just for your quiz, but for your real-world practice. Let's start with a foundational definition you need to lock down: the difference between type 1 and type 2 diabetes. With type 1, the body is completely unable to produce insulin, zero. But with type 2, which, by the way, is what you're going to see in the vast majority of your older adult patients, the body simply does not make enough insulin. For your exam, definitely remember that older adults with type 2 usually don't require insulin therapy right out of the gate. They typically rely more on lifestyle modifications and oral medications first. Okay, so what are your absolute high-yield nursing priorities here? Well, participating in early detection through screening is obviously vital, but equally critical for your day-to-day practice is vigilant foot care and examination. Listen, older adults with metabolic disorders are at incredibly high risk for complications here. If you remember literally nothing else about daily interventions for diabetes, remember this: strict glucose monitoring and incredibly vigilant foot care. Moving over to thyroid disease, you really must be able to recognize the classic cues for hypothyroidism in the older adult. If you've got a patient presenting with unexplainable fatigue, profound weakness, and maybe some slowed thinking, those are your red flags. Memorize these 3 cues. They're classic quiz material, mostly because they're so easily confused with just general aging if you aren't paying close attention. Moving right along to Section 2, musculoskeletal and joint health, focusing on structure and safety. So we're shifting from metabolic processes to structural changes, which obviously heavily impact an older adult's mobility, their safety, and their overall independence. Just take a look at the striking visual difference here. On the left, we've got a microscopic view of normal, healthy, dense bone. But on the right, you can see the highly porous, fragile structure of osteoporotic bone. It looks almost like a sponge, right? This visual should instantly cement the whole concept of skeletal fragility in your mind. A minor trip for you or me could mean a totally devastating fracture for a patient with that bone structure on the right. And notice how this internal, microscopic bone loss actually connects to the external cues you're going to observe on the floor. Looking at the progression here from age 40 down to age 70, you can literally see how that reduced bone mass leads to these really pronounced postural changes, like a stooped back. When you walk into a patient's room, that external posture is your immediate clinical clue that osteoporosis might be in play. So what are our actionable nursing interventions? What are we going to do about it? Number 1, above all else, follow fall prevention precautions. That is a massive priority. To combat the bone loss itself, we also really encourage increasing weight-bearing and muscle-building exercises. And finally, and you'll definitely want to jot this down for your quiz, drill down on these specific supplement numbers. Postmenopausal females need 1,200 to 1,500 milligrams of calcium, and older adults 70 and older need 800 IU of vitamin D. Let's transition from bones to joints for a second and compare the 2 major arthritic conditions you're definitely going to be tested on: osteoarthritis and rheumatoid arthritis. Differentiating these 2 is a classic hurdle for nursing students. Just notice the distinct patterns of joint involvement we're showing here. OA often hits the hands and the weight-bearing joints asymmetrically, whereas RA tends to be symmetrical and much more systemic. Let's actually break that down into the exact text definitions you need to know. Osteoarthritis is a degenerative joint disorder. And the absolute key time frame here: morning stiffness that resolves in under 30 minutes. Rheumatoid arthritis, on the other hand, is an autoimmune disease, and it's characterized by morning stiffness that lasts way longer than 30 minutes. Lock in that 30-minute differentiator, guys. It is an absolutely critical assessment cue. Next up, Section 3. Cardio and respiratory changes, our vital systems.
These are the vital systems, and the crucial point to remember here is that frail elderly patients just have far less cardiac and respiratory reserve. When these systems face increased demands, older adults can decompensate incredibly fast. Take a look at this cross-section showing age-induced arterial thickening. This perfectly explains why hypertension is the single most common chronic cardiovascular disease in older adults. Over time, the tunica intima and media physically thicken up, and the vessels lose their elasticity. The result? You get a much narrower lumen, which significantly increases peripheral vascular resistance. It's kind of like trying to force water through a stiff, clogged pipe. And here is the direct consequence of having that narrowed arterial lumen. Because of that increased vascular resistance we just talked about, the heart has to pump so much harder just to push blood through the body. Over time, all that extra work forces the left ventricle to thicken, like you can see in the visualization on the right. This left ventricular hypertrophy is a major stepping stone toward eventual heart failure, which is obviously a highly common issue in geriatric care.
Shifting briefly to the respiratory system, there's a really specific point from your source material I want to highlight. It notes that when you're assessing for a respiratory infection in an older adult, there's an element of wait and see. The text states they usually have baseline increases in their temperature and white blood cell counts simply as a result of age. Make sure you note this slightly counterintuitive heuristic for your exam because their baseline vitals can present very differently than what you might expect in a younger patient. Finally, Section 4, our clinical case study featuring Nancy. To really synthesize all these cardiovascular and neurological concepts, let's look at a real-world scenario. But before we meet Nancy, we need to quickly differentiate between a TIA and a full stroke. A transient ischemic attack presents with stroke-like symptoms that actually begin to resolve within minutes. But please, do not be fooled by that. A TIA is a massive clinical warning sign indicating a huge risk for a major stroke within the next year. A stroke, conversely, is a serious, lasting interruption in blood supply, occurring mostly in persons over the age of 65. So enter our patient, Nancy. She's 79 years old, and she arrives at the ER with some very alarming morning symptoms. She's got expressive aphasia, meaning she's having a lot of trouble finding her words. She has a noticeable left facial droop, left-sided hemiparesis, which is weakness on that side, and mild dysphagia, meaning she's having difficulty swallowing. This paints a very clear, acute clinical picture of a suspected cerebrovascular accident. When we open up Nancy's chart, her history just lights up with the exact cardiovascular risks we discussed earlier in this explainer. She has a history of paroxysmal atrial fibrillation, or PAF, hypertension, and hyperlipidemia. She's already taking medications like amlodipine for her blood pressure, along with aspirin. That systemic vascular resistance, combined with the potential for a cardioembolism from her AFib, directly set the stage for the acute neurological emergency she's facing today. And that brings us to the end of our explainer, but I want to leave you with this pretty provocative question to ponder before you sit down for your quiz. What specific role do diagnostic tests play in evaluating Nancy right in this moment? And even more importantly, how will knowing the exact type of CVA, whether it turns out to be ischemic or hemorrhagic, fundamentally change the nursing actions and the care plan you're going to develop for her? Do a little research on that, make sure you lock down those metabolic and musculoskeletal definitions we went over, and you are going to be in great shape. Good luck on your quiz.